As we speak now, the prevalence has reduced dramatically, including how HIV and AIDS presents. Back then it was, first of all, a diagnosis of HIV was like a death sentence. There was no treatment. In the early 2000s, a lot of our people started accessing antiretroviral therapy, especially cutters of the American government through the Presidential Emergency Relief Fund for AIDS and PEPFAR. And of course, enrollment on ART changes the whole picture. People start living a near normal life. The symptoms disappear. That also goes with the disappearance of stigma, because back before the advent of the antiretroviral therapy, because of the presentation of the disease, there was a lot of stigma. The situation is no longer the same. Although we have no cure, we have no vaccine, but with antiretroviral therapy, with other availability of prevention interventions, people are living a much better quality of life now. We have approximately 1.4 million people out of a population of about 42 million living with HIV now, about 5.5 HIV prevalence.
UNAIDS says that there are inequalities that are creating an impediment to the end of the epidemic, or at least to improving the picture overall. How does this translate in Uganda? Are you in your country seeing such inequalities?
One of the underlying driving factors is inequitable distribution of wealth. And because of young people, especially the girl child, not accessing some of the basic things, menstrual hygiene materials, scholastic materials, they are forced into, transactional sex. They are forced, to go into relationships where there is power imbalance with the older men, with whom it's not possible to bargain for protective sex. So yes, indeed, the inequalities still exist. They are part of what continues to drive new HIV infections. We are focusing on young people. I told you about the 54,000 new HIV infections in 2021 alone. 20,000 of those were amongst young people between 15 to 24. And 2/3 for every 5 infections, 4 of those were girls. So our priorities now are focusing on young people, focusing on the adolescent girls, young women and boys, but also, people who are at the margins, vulnerable populations, the commercial sex workers, the incarcerated populations, the men who have sex with men. That's the only way that we'll be able to meet the 2030 targets.
And speaking of intervention, Uganda approved the use of the injectable HIV preventable drug, Cabotegravir. Tell us more about that. What does it look like in terms of deploying this strategy in the country for prevention? Is it also being considered for treatment?
For it to be protective. The injection, removes lots of barriers. It addresses the adherence challenges. It addresses the stigma and discrimination challenges. Sometimes people are in a relationship and they have not necessarily shared their HIV status with their partner. And the PrEP injectable, addresses that. So it's a welcome additional option. As a country, we just say, yes, we shall add this to our options. We will go into we will sit down with our partners, look at the resources available. But our approach has always been that every time there's a proven cost-effective intervention, we make sure that our population accesses it. The more the options, the easier the fight.
To what extent is Uganda winning the war against AIDS? Can we say that Uganda is winning the war, or is it very much a challenge still?
Uganda is winning the war. In 2016, the UN set up the 90-90-90 targets, where 90% of the people who have HIV test and know their status, and 90% of those who test positive are enrolled on treatment, and 90% of those who enroll take their medication. Uganda was one of the 8 countries globally that achieved the 90-90-90 by 2020. Following COVID, like most countries, some of our gains were reversed. We saw new infections rising. The curve is not quite bending at the rate that we had expected it to bend. I've just mentioned new infections. We have complacency. We have, we see infections amongst young people.